So for doing the dressing change, what I'm going to do first, because I'm going to verify the MD orders, I'm going to gather my necessary supplies. I'm going to check for any allergy pertinent labs, anything like that. Going to knock on the door. Going to introduce myself to the patient. I'm going to do hand washing. Going to close the curtain, and I'll wash my hands after I touch that curtain. I'm going to verify the patient's identity using 2 identifiers. What I'm going to do next is I'm going to set up a wastebasket. I'm going to apply my clean gloves. But first, before I apply my clean gloves, I'm going to put on a mask, and I will also put a mask on the patient. And I'm going to put on my clean gloves. I'm going to look at the line. I'm going to palpate for any sort of tenderness, anything like that. I'm then going to remove this old dressing. I'm going to put it in my trash can. Now I'm going to visually inspect the area, the insertion site, anything around it, but I'm not actually going to touch it. I'm going to take off my gloves for my hand hygiene. I'm going to open my kit, put on my sterile gloves. Use my alcohol swab to clean the area. Working in circular motions. I'm going to allow that to dry completely. Throw that away. After that is done drying, I'm going to take my sponge applicator and disinfect the area around the catheter and the insertion site. Going in a back and forth motion. And I'm going to make sure to clean as much as the area as this Band-Aid will cover, or my gauze will cover. My trash can. I would apply gauze. I'm going to apply my dressing. I'm going to move my initials, date and time on here. Take all my supplies and throw them out. Now I'm going to ask if there are any sort of pain. I'm going to lower down the bed rail again, and I will make sure to let them know where the call light is, put that in reach, and then I will go document.